Hi, my name is Dr. Anu Bankole and I'm a general practitioner under Lagos Province 40 of the Redeemed Christian Church of God. Today we'll be discussing hepatitis. Hepatitis, simply put, is inflammation of the liver. Just like when you have a cut on your skin and the skin becomes red, swollen and painful, this is what happens to the liver when you have hepatitis. There are various causes of hepatitis. It can be bacterial causes, viral causes or fungal causes. But today, for the purpose of this discussion, we'll be talking about viral hepatitis. There are various forms of viral hepatitis. There's hepatitis A, B, C, D, and E, just like the letters of the alphabet. And there are acute forms and chronic forms. Acute forms occur over a short period of 6 months, but chronic forms can extend from 6 months to years. And hepatitis A and E are the acute forms, and they are contacted via fecal-oral routes, meaning that just like cholera and other fecal-oral diseases, it's gotten by ingestion of feces containing these viruses. So either from dirty hands that have not been washed properly after using the toilet, or dirty hands cooking, these viruses can be ingested and people get infected. It can, however, be treated with medications and rehydration. The chronic ones are hepatitis B and C. Hepatitis D needs a baseline hepatitis B infection to be able to manifest in an individual. Hepatitis C, which is chronic and also very virulent, has a cure. So taking antiviral medications for a course of a couple of months would lead to the cure of that virus. Hepatitis B, which is the most virulent and which we'll be expatiating on today, is the only one of them that doesn't have a cure. And it's more common in our environment than we think. About 12 to 13% of the Nigerian population have hepatitis B, and unfortunately many of them are unaware, and they present to the hospital when it's already too late, about 15 to 20 years down the line, when they have developed hepatocellular carcinoma, which is a primary liver cancer, meaning that the cancer developed primarily in the liver and then can spread to other parts of the body. This is commoner in men. There are various ways in which you can get this infection. It is surplus in body fluids like seminal fluid, vaginal fluid, sweat, and saliva. So kissing, unprotected sexual intercourse can be forms in which this virus can be contacted. Sharing of sharps also is a form in which the virus can be contacted. So intravenous drug abusers are at risk. People who share their clippers and needle pins in the salon or at the hairdresser salon and the barber salon are at risk of getting this infection. Blood transfusion is another important route of transmission of this infection. That's why it's important for you to go to very good hospitals where you are sure that the blood that's been transfused to you and your loved ones are properly screened for viral infections, syphilis, and other forms of infection before they are being transfused to our wards. There are various ways in which this virus manifests in the human body. These are what we call symptoms. You can have non-specific symptoms like fever, malaise, chills, rigor, just like malaria symptoms. And then there are other more specific ones like yellowness of the eyes and dark colored urine. These symptoms are also not specific to hepatitis alone. There are other chronic liver diseases which can be obstructive or non-obstructive that can present with these symptoms. This is the reason why it's important for you to know your status. So you present to your general practitioner and just get a hepatitis B panel test done. You can get hepatitis B and C test done first, and if you're positive, you get a panel test done so that we can know what level of the infection you are in, if you require treatment at that time or not before it's too late. Health is wealth. May God be with us all. Have a lovely day. Thank you.